Hello again, everyone. Today's question in our continuing 10-part series is, how do I get rid of these fungal nails? And by fungal I mean those thick, yellow, crumbly, ugly looking toenails that nobody likes and everybody wants to get rid of. And that is a very common question. And the answer is, it's tough to get rid of fungal nails. Now, it is tough to get rid of fungal nails, but since you want to know the answer, I'll give you some things that we do for it. Number one is you need to get rid of all fungal infection on your skin, which is commonly referred to as athlete's foot. That cracking, scaling, reddish looking, itchy problem on your skin. Well, what happens is the fungus jumps right off the skin onto your nail and sets up shop there and causes a problem. It's a lot easier to clear the fungal infection off the skin than it is off the nail. So you want to make sure that you don't have a skin infection, because you can clear out the nail infection and then it's just going to come right back off your skin. Secondly, you need to apply a topical medication directly to the nail. And that is an expensive medication, and it supposedly penetrates through the nail underneath the nail bed, which is where the fungus starts. That's why it's so tough to get rid of fungus in the nails. And I don't know if any of you have seen that commercial on TV. The fungus doesn't just reside in your nail itself. It's underneath the nail in the nail bed. And you need something to penetrate through there and get at the source of the problem. This topical is penetrating. On top of that, you need to take some sort of oral medication to act in a synergistic way with the topical you're using to totally eradicate the fungus. And you need to get a blood test to make sure your liver is okay, because this oral medication for fungus has side effects. And then, after having said all that, you can go off this anti-fungus regimen after you're healed up, which could take as long as 3 to 6 months. And then, now that you're not taking the medication, it just comes back again. Very frustrating for both the patient and the doctor. And oftentimes when patients hear all this, they're really not so interested anymore in getting rid of the fungal nails. There are some household wives' tale type of solutions that I've heard and read about over the years, applying Vicks, which is that vapor rub, vinegar. I've even heard that if you urinate on your own feet, that makes the fungus go away. I mean, I'm not going to vouch for any of those things. But suffice it to say, it is tough to get rid of fungus when it's in your toenail. The idea is to never let it get there in the first place. And some of the things you can do to avoid that are making sure your skin is at all times clear, because I said it's really easy to get fungus off your skin. And secondly, don't expose yourself where fungus grows. Fungus grows in 3 areas mainly. They're the 3 big ones: public showers, public pools, and hotel carpets. So wear protective shoe gear in all those areas, and you can diminish your chances of picking up the fungus in the first place. This is the end of this question, and thank you for watching, and we'll look forward to seeing you in our next part of the series. Have a great day.